Okay, so we're now going to go through a little bit more rehab ideas for elbow injuries. So these are kind of to work on stiffness, pain, post sort of, well, radial head fracture, things that we've been going over. So those got, 3 exercises, then we'll move on to me and I'll go through 3 exercises.
First one we'll do is on the wall. So it's quite nice to start off at this at the early stages because we're not, loading through the elbow and through the shoulder as much. And then obviously we could progress and regress them as well, depending on sort of the client. So again, these are nice ones that we can progress on by doing them like on the couch. So you're loading through a little bit more, or even sort of on the floor. So you're sort of, loading through the arm, through the shoulder. So this will probably be a little bit of like your later stage ones. So looking at more our eccentrics. So getting a little bit more low and a little bit more like control through those positions as well. So you can have that arm sort of supported and sort of really working on that eccentric, nice control going over into that sort of supinated position. This one's looking at more like our pogos. So you'll be on all fours through here, having a little look at sort of jumping and landing through here. Obviously, again, if it's my right elbow and we're a little bit not as comfortable, confident with this one, we can have a little look at staggering the arms, so we're taking up a bit more of the load on our left. And again, with similar to our flexion extension ones, we can have a little look at staggering wrist position, having a little look on those ones. And again, you can pop those onto more single arm as well.
So then we've got another 3. With this, we're gonna have a resistance band. We're trying to pull traction through the band to gain that extension. So band's gonna come through, well, your arm's gonna go through the band. You're gonna take a good kind of decent sort of distance away from the bed so we've got a good amount of extension. And at this point, the band's really gonna wanna pull that elbow inwards. So from here, what you're gonna work to do is just bend out that elbow against the band, then let that band slowly pull you back in. So we're still working on control as well. So you're not just letting that band pull you back in really quickly. We are gonna let it come out and then really work to control that back in. Now we're gonna move on to a bit of strength. This is both gonna be through wrist, forearm, elbow, and then up into that shoulder, into the shoulder blade as well. So we're gonna look at some plank stuff. So there's loads of progressions here. We can go plank on a wall, elevated surface, floor, single arm, double arm, side planks, and then also looking at shoulder taps and rotations, all of which to work on strength and stability through there. So upside down kettlebell hold. So depending on how, this is an 8, but we can play around with some other ones as well. Bent arm, straight arm, depending on what feels comfortable. Let's go bent first. We're just working lots of load through the wrist, forearm, shoulder as well. Lots and lots of load there. And then you can add sort of walks and stuff into it as well if you want a bit of a different element. So with these exercises, always remember to stay within a pain-free sort of range, inside that comfort, avoid sharp pain and always gradually build. If things worsen or don't really get any better, then definitely best to seek a therapist over here at Injury Active. So thank you for watching and keep an eye out for any more quick tips.